Well.
Okay, thank you, Tom. Good evening, everyone. Sorry about that slightly delayed start. So, yes, as Andrew said, I'm going to talk to you about young lamb diseases, and really specifically, well, I say specifically watery mouth and joint ill. I will be specifically referring to those diseases, but as you'll see, I'm coming at it perhaps from a slightly more holistic point of view. So next slide, please, Tom. So this is a chart here to show really probably what you're all familiar with, roughly when most lamb losses occur, and you'll see there's quite a big chunk, the purple chunk here, of losses between scanning and lambing. So these are abortions, ewes that die with lambs inside, like on their back, or prolapses. But the green, almost half the chart here, 49% lambs dying either at lambing, so born dead, difficult lambings, or dying within 48 hours of birth. And this was based on a survey done by HCC in 2010 to 11, covering both indoor and outdoor lambing flocks. Next slide, please. And just a little bit more sort of detail on this, on the levels of lamb mortality really. In a recent study, and I've just mentioned this at the bottom of this slide because it's something you might like to look at. It was a study done by a vet called Alex Corbishley from SRUC, funded by the levy boards, on survival of newborn lambs and calves. And there's a video on YouTube called The Rewards of Maximising Newborn Survival, which I'd suggest is well worth a look at. But in that study, they found that lamb mortality up to 7 days ranged from 6 to 12.8%, with a mean of 9.5%. So when you sort of translate this, it means that almost 1 in 10 potential lambs dies either at lambing or before they reach a week old, which isn't great, is it really? And we all know how difficult it is to keep them alive. So I'm not, you know, sort of saying it's an easy thing, but it is a sort of figure that gets picked up upon, and it hasn't changed much really in the last 40 odd years. You know, we haven't really improved on that, which makes me sort of think it's not just that we need to be refining what we're doing, but maybe doing things a little bit differently, which I'll come to a little bit more. Next slide, please, Tom. Don't worry too much about the detail on this. Just to mention, another study I looked at found that farmers who recorded lamb losses lost more lambs, farmers who recorded losses lost fewer lambs than people who didn't record losses. And clearly it's not just the recording that makes the difference. It's just that you need, well, once you start measuring things, you understand where the losses are, and then it's easier to do things about it. It can be pretty depressing at lambing time, I know, to keep recording deaths, but I think a really easy way of getting some very basic information is just to keep a tally of losses, and whether they're wet, i.e. born dead, didn't breathe, didn't get up, or whether they're dry, so they've lived and then died at 24, 48 hours old, or whatever. But it is useful also to record whether they're singles, twins, or triplets, because then you can attend, if you're losing lots of singles, it's probably because they're too big and lambing difficulties. Lots of triplets, probably the opposite, too low birth weights. But I also think it's actually quite useful to record ewe age, especially really your yearling ewes or ewe lambs, if you're lambing ewe lambs. And if you have a practice of putting different coloured tags in for each year of birth, that makes it very easy then for people just to record, oh, it's a white tag ewe that's lost a lamb, or a blue tag, or whatever. So I think that's it's a really valuable thing to do anyway, but it really helps you with recording your losses. And if you're quite a small flock, you can just keep a tally. In larger flocks, it's best just to have a whiteboard or something, and each day record the losses and then wipe it clean and transfer the data somewhere else, really, so it doesn't get, excuse me, too depressing as the numbers add up, which they inevitably do. Next slide, please. So another graph here. This was a study done on indoor lambing flocks where they tried to determine the cause of death of lambs up to about 48 hours old. And you'll see here the purple, almost in this study, it's not always the same, but in this study, almost 40% of lambs' deaths were attributed to infection. Now, some of these might not have been obvious from how the lamb appeared, but on post-mortem, they were attributed to infection. So, that clearly is contributing in indoor lambing flocks to quite a high percentage of losses. Outdoor lambing flocks, generally, infection is much less important. Lambing difficulties, predation, things that are more important. Next slide, please. But I think also it's not really quite as simple as almost 40% of lambs dying from infection. And I've got a little quote here from David Henderson's book, that 2/3 of lamb deaths are due to conditions which have their origins during pregnancy rather than around the actual time of lambing. And I think that will be particularly true of things like watery mouth. You might be about to start lambing and speak to your vet about what can you do about watery mouth this year. And often then really it's almost too late. You need to be thinking of it way ahead, getting ewe condition right, feeding right, everything. Because if you start to have a problem, those are sort of things that obviously you can't correct. Next slide, please. And I've got a few sort of examples of that here, really. So I've just said, the reason behind lambs dying is often a combination of things rather than one thing. So, Tom, I'm just going to need you to run through the bullet points for me. Yeah, thank you. So, lamb dies from watery mouth. Why did it die? Well, we said it's died from watery mouth, but why did it get watery mouth? Because it didn't get enough colostrum. Why didn't it get enough colostrum? Because the ewe didn't mother it well enough and she didn't have much colostrum. Why didn't she mother it well and have much colostrum? Because she was thin and had subclinical twin lamb disease. Why was that? Because she was lame. So then you look at it, well, did the lamb die because of watery mouth? Well, it did, but in other ways, it actually died because its mother was lame. And I've got another example on the next slide. So lamb dies from watery mouth. Why did it get watery mouth? It had enough colostrum, but the antibody levels in the lamb were still low. So why was that? Its mother was old and her colostrum was poor quality. Why was that? Because the flock replacement rate has been too low, so there's too many old ewes in the flock. So although the lamb died because of watery mouth, there's an underlying problem in this flock with the age structure in the flock. So things are generally much more complicated than just that it died from watery mouth. Next slide, please. And I think in the past, we've tended to approach things by addressing individual diseases or problems rather than by looking at how we could make the whole system better. And I heard someone actually the other day talking about the National Health Service and saying they saw it as a disease treatment service. So I think even in medicine and in veterinary, we've been trying to tackle problems rather than looking at the whole system. And maybe the fact that lamb mortality hasn't changed in the past 40 years means we need to be looking a bit more holistically. Next slide, please. So we'll just have a bit of a look at body condition score. And I don't think I need to tell you that lambs born to thin ewes are more likely to die. And the reasons for this are because generally they have lambs of lower birth weight. These lambs have less brown fat. Now the brown fat is shown in these couple of pictures I've got now. So the first picture shows the brown fat is around the heart and the kidneys. So there's a kidney under here and you can see the covering of brown fat. And that's the source of energy for the lamb in its first hours / days of life. Obviously colostrum helps as well, but the burning the brown fat gives it the energy to stand up and to start to suckle. And the second photo here shows a kidney with no brown fat over it. So it might be just that the lamb's used it, probably is that it's used it all up, but if the ewe was thin, the lamb will have less of this brown fat when it's born, so it has less reserves to keep it going. Also, ewes that are thin often have, even if it's not obvious, they may have a degree of subclinical twin lamb disease, and that results in reduced mothering behaviour, and also their colostrum is generally poorer quality and also less of it. Next slide, please. And as you'll all know, overfat ewes can also be a problem, and the reasons for this are they're also susceptible to twin lamb disease for a different reason really. The fat in the liver means their liver function isn't so good, so they often go off their feed. Prolapses, but I would definitely add there, prolapses happen in thin ewes too. Being fat isn't the only reason for getting prolapses, but it certainly can be an issue. And as we all know, overfat ewes can be more prone to difficult lambings, especially if they're carrying a single. Next slide, please. Just to remind you all, you have to handle ewes unless they're winter shorn or they're wool shedders, and you can actually see their condition, and even wool shedders actually often have enough wool that you really need to handle them to get a good indication of body condition score. And often ewes, you know, they're carrying 3 lambs, they've got a big belly on them, they look full, they look big, but you put a hand on and realise that actually it's all lambs and there's no condition there. And you don't have to sort of agonise, is she 2.5, is she 3, what is she? But if you put your hand on, you can easily feel the spine sticking up, and you can feel the bones and spine sticking out at the side. She is too thin. It should take firm pressure to feel the ends of the bones in a ewe at condition score 3, which is the target condition score for lowland ewes at lambing. Next slide, please. So why might ewes be too thin at lambing? The first thing is obvious. If they're old, and often obviously this goes with being old, problems with their teeth or underlying disease, e.g. liver fluke. So I've got a couple of pictures here of tooth problems. So this picture on the left, her incisors, still full mouthed, but you can see here how much the gums have receded, and this will definitely be affecting the way this ewe is able to eat. And you know, in my view, a ewe like that should have been culled, unless perhaps you're keeping her on a sort of early lamb system and going to wean the lambs early. But for a more extensive type system, she's no good with teeth like that. And the second picture here shows the a problem with the back teeth, the molars, which obviously you can't visualize these in the live animal. Sometimes you can feel a swelling of the jaw, but you can see here they don't look too bad at the top. But you can see that step here and that one there. That ewe won't be able to eat forage normally, and she's almost bound to be thin. Next slide, please. So a few suggestions for reducing the number of thin ewes in the flock. First obvious one is nutrition, and it is both what you feed and how it's fed. Access to feed, enough feed space, whether it's fed fresh every day, how short the chop length is, and things like that. So it isn't just what you feed. And when access to feed is restricted, you generally find the fat get fatter and the thin get thinner. So it's really important to group ewes according to body condition score. You know, sometimes people will say, oh, I don't think those ewes can be short of food because look how fat some of them are. But that's because of the competition, and you know, there's often a reason that fat ewes are fat. They're greedy, they're dominant, they get in there and get the food first. So it's just really important to split them up according to body condition score and give the thin ones a chance. And another thing I quite often see actually is yearling ewes running in the same group as mature ewes, but they don't compete well. They're less dominant, they're changing their teeth, they need to grow, whereas the mature ewes just need to maintain their condition. So they need to be kept as a separate group. Next slide, please. This picture is really just to show one of my little bugbears, not in this picture actually, but ring feeders and bales in ring feeders. When hay or silage bales are just dumped into a ring feeder and the ewes have to pull it off themselves. With silage, certainly the bale usually gets stale, so they don't eat as much. It can be hard for them to pull it off, and it's much better if you can be using something like a bale unroller and put some in fresh each day, you'll get much higher intakes of the forage. Next slide, please. Just a word on metabolic profiles. These can be used to check the energy and protein status of ewes in late pregnancy. So you need the vet to come out to take blood samples. Next point, please, Tom. Collect blood samples, I generally say about 3 weeks before the start of lambing. See, some references suggest 4 to 6 weeks, but that's often too far from lambing to show any problems. You know, it's once the lambs are really draining on the ewe is when things start to show up. So 2 to 3 weeks really before the start of lambing is when you want to be doing this. And you'll usually be looking, or the vet will usually choose to look at 3 things. Urea, which is an indicator of short-term protein status, really what they ate that morning. Albumin, which is a protein in the blood, which is an indicator of long-term protein status. So it might indicate there's been a problem with liver fluke or something which reduces protein levels, or just the diet hasn't supplied enough protein over the longer term. And BHB, which stands for beta-hydroxybutyrate, which is a measure of energy status. So high BHB levels show that the ewe is trying to break down her own body tissues because she's not getting enough energy in her diet. And if the BHB levels get too high, she'll show signs of clinical twin lamb disease. Next point, please. Thank you. So this is a slide out of the YouTube presentation that I mentioned earlier. And the important thing to look at here is the 2 tables on the right. So the top ones with a green line around it, these are metabolic profile results for some ewes that weren't lame, and the bottom ones in red are from lame ewes, all running in the same group. And the BHB ones is the main one I want to look at. Well, they've got it down here as BOHB, but it's the same thing. In the top one, there are a couple here. This wants to be below 0.8 in twin-bearing ewes coming close to lambing. There are 3 here you'll see, just a little bit high. But if you look at the ones in red, there's only 3 actually that, well, actually only 1 that's less than 0.8. And that ewe there, 3.71, will almost certainly be showing signs of twin lamb disease. These other ones that are high but not as high have got subclinical twin lamb disease, but won't necessarily be showing it. So that you can really see how the lameness is probably affecting the intake of these ewes, and meaning they're struggling to get enough energy. The albumin, you'll see most of these are lower than the level that was suggested as being ideal in this study, which is above 30. Some labs say above 24 is okay, but I would agree really for good nutritional status, their levels want to be above 30, but it is quite common to see levels lower than they would ideally be in ewes, and this may be something we need to attend to a bit more to make sure sheep are getting enough protein. Next slide, please. Moving on to talk about colostrum. Remember the 3 Qs, so quality of colostrum, quantity, and getting it in quickly are the important things. Next slide. Some of you may have seen or used one of these. It's called a Brix refractometer. You can buy them quite cheaply on the internet, and you basically put a drop of the colostrum on this end here, and then look through here, and there's a scale that you can read against. I think, well, how useful are they? I think they can be useful, but the only thing they are measuring, so they're measuring the specific gravity in the colostrum, because the antibodies contribute significantly to the significant gravity. So if there are low levels of antibodies, the specific gravity will be low. But what it doesn't tell you at all, is how much colostrum there is. And sometimes ewes can produce very small quantities of colostrum, but it's very concentrated, so it looks good on this, but actually there's very little of it, so it isn't that good. So I'm a bit I wouldn't suggest that you all rush out and buy one, but if you're interested, you might want to play around with one. Next slide, please. And next point, please. So in general, younger ewes produce better quality colostrum than old ewes. When I say younger, I don't necessarily mean yearlings. I mean just mature ewes rather than yearlings and mature ewes rather than very old ewes. Antibodies are protein, so it's important to feed sufficient protein pre-lambing in order to get high antibody levels in colostrum. You know, if the ewe's low in protein herself, then she's not going to be able to make antibodies that pass into the colostrum. And it also means, I expect you're all probably aware that ewes around the time of lambing have reduced immunity to worms, and that's generally because there just isn't enough protein there for them to maintain their antibody levels. But if you feed more protein, they maintain better immunity to worms. So diseases like liver fluke in particular depress blood protein levels, and that will adversely affect colostral quality. Next point, please. And one thing it's important to be aware of, all powder colostrum products have antibody levels that are much lower than good quality natural colostrum from the ewe. So the highest of the powdered antibody colostrum products have a IgG, which is the main antibody in colostrum. So they have an IgG level of about 25 grams per litre. That is the best ones, but they can be down as low as, say, 3 grams per litre, whereas natural colostrum, if it's good, will have a level of about 50 grams of IgG per litre. And frustratingly, powder colostrums don't have to state on the label what level the IgG is at. So unless you've got a bit more information, and there have been some studies done actually which have rated colostrum products according to the level of antibody, but unless you refer to something like that, you're not going to know whether what you're using has a decent level or not. Next slide, please. Oh, sorry, notes. Yes, and this once again is taken from the neonatal survival study, and this is showing some results from, they look at one farm, a farm at SRUC, so it's a college farm, so generally managed quite well. The forage will be analysed and the diet will be designed to ensure that the ewe's nutritional needs are met. And in fact, the losses overall in the flock of lambs were quite low. So as you'll see here, this is losses between scanning and 24 hours old. Triplets, the losses were high, as we'd expect, or not as we'd expect, but we'd expect the losses to be highest in the triplets. But only 9% of the twins died, and none of the singles were lost. But the things that they found in this flock, and remember this has been a well-fed flock, but the things that made the difference to losses was whether the lambs were singles, twins or triplets, and the albumin level in the ewe. So this graph here shows these on the left here are ewes that didn't lose a lamb, and the average albumin level was about 30. These results are from ewes that lost a lamb, which wasn't all that many, but the albumin level was lower, which isn't really surprising based on what I just said, that if their albumin level is lower, there's less protein available to go into the colostrum. Next slide, please. So how much colostrum do lambs need? The general rule of thumb is a minimum of 50 mils per kilogram in the first 6 hours. But ideally, they want to have that 50 mils per kilogram within the first 2 hours of birth, and then another 50 mils per kilogram by 6 hours. As I've already said, thin ewes produce less colostrum than fit ewes. Also, the bond between the ewe and the lamb is important in terms the ewe excuse me, will encouraging the lamb to get up and suckle, because antibodies are much better absorbed when a lamb suckles than if it's fed by stomach tube. And the next point, just and lambs that have had a difficult birth are at high risk of not ingesting colostrum soon enough, so they're likely to need extra help. And this next graph is taken again from the same study. It does refer to calves, but I think the findings are almost certainly transferable to lambs. So if we look on the right here at B, now the yellow line here is the level of IgG we're aiming for. So ideally, you want calves to have more IgG, have it to be above this mean line in the box, to be above the yellow line. So the highest levels here were in calves that were born without assistance, and calves that had an assisted birth had slightly lower levels of antibody. Looking at the graph on the left here, we've got calves born with no assistance have the best antibody levels. Calves that were born without assistance but had to be, this is suckling. So this is calves that had no assistance to suckle had the best levels. Calves that had to be taken to the mother and helped to suckle, okay, but lower than the ones that did it on their own. Calves that were tube fed, their mother's own colostrum, don't have quite enough antibody, even though it's the mother's own colostrum. So either they didn't have as much, or, as I've said, it's not absorbed as well if it's fed by tube rather than they've suckled it themselves. And the calves that were fed artificial colostrum had the lowest levels. Next slide, please. You can measure antibody levels in lambs from a blood sample. It is actually something that can be done quite easily and cheaply using a refractometer similar to the one I showed you earlier. It's not so easy to do it actually on farm because you need to spin the blood down and do it with the serum, but it is something vets can do in their own sort of practice labs rather than have to send away and spend too much on it. And these were blood antibody levels from the SRUC farm that they did the study on, and that line here, or 1 in 10 lambs had very low levels of antibody, and 1 in 3 had lower than the ideal level. And blue here is triplet lambs, green is twin lambs, red is singles. You can see, as we'd probably expect, that it's the triplet lambs that tended to have lower levels, and the ones that didn't get enough antibodies from colostrum. Next slide, please. These pictures, this is a lamb, as you can see, outdoor lambing, born outside, noticed at about, it was first seen in the morning, having been born, by the evening looking like this, which is pretty obvious it hadn't fed. And I just want to show you now. So the lamb was then tube fed and seemed to do okay for a bit, and then died about 3 weeks later. And this is a post-mortem of that lamb when it's about 3 weeks old. So by now, this bit here is the rumen. It's starting to eat a bit of grass. This here, that's a bit of the liver sticking out there, but this here is a big sort of abscess of part of the liver. And the next picture shows once that's been cut into, you've got this big abscess in the liver. So although we're talking about watery mouth, infections can go in through the navel and cause infections elsewhere in the body. It could have been abscesses in the lungs, but it's just the failure to get that colostrum in early enough and for the antibodies to get into the blood. Next slide. So watery mouth, you'll all be familiar with the signs, including lethargy, not wanting to suck, salivation, hence the watery mouth, bloating and retained meconium. And the disease, those signs happen because the gut becomes colonized with E. Coli bacteria. And bacterial proliferation is really made possible or facilitated by inadequate colostral intake. So if the lamb's had enough colostrum, there are antibodies in its stomach which will bind to the E. coli and stop it multiplying. And if the E. coli does manage to get through the gut wall and get into the bloodstream, there are antibodies there to mop it all up, providing that lamb has had that colostrum. And it's important to, well, this is a relevant point, that when the lamb's born, pH of its stomach is about pH 7. As you know, the true stomach is acidic, but that takes about 36 hours for that to happen in a newborn lamb. And that's one of the reasons that the E. coli can get in and take hold in that first 36 hours. Once the abomasum becomes more acidic, the E. coli, don't like that acidic environment, and watery mouth won't develop. So it's that critical time when the lamb needs the colostrum and the stomach pH is neutral, so the E. coli can colonize. This next picture here is, I hope you've all had your tea, the intestines of a lamb that died from watery mouth. So you can see how they're all dilated with gas and probably liquid in there as well, and this mottly pink. So they're blown up, but it's all the intestines. There's nothing you can do to let them down when they're blown up. It's all gas in the intestines, and that, if you see the clots there, that's in the umbilical artery. That's indicative of infection as well. Next slide, please. I just wanted to briefly mention E. coli vaccines because there is a little bit more interest in this because we're trying to reduce routine use of antibiotics. So these work in a similar way to the vaccines given to cows to prevent scouring calves, usually due to E. coli, rotavirus or coronavirus. So they have to be given, next point please, Tom. They have to be given before lambing, but then it's important that the ewes fed well enough to get good levels of antibodies and colostrum, and also that the lamb takes in enough colostrum to get the protection from the vaccine. There's no point in giving the vaccine and then the ewes being underfed or the lamb's not getting colostrum, because that will do no good at all, because as you'll know, no antibodies pass across the placenta in lambs or calves. There aren't any UK licensed sheep E. coli vaccines, but there is one that can be imported. So it is an option, but not something I would necessarily be thinking of as a first line, really, but just to make you aware that it is an option. Next point, please. But there is no data on their use in the UK. So as I say, I definitely wouldn't be suggesting this is a good option for you to go down. I think the management options are the most important things, but it's just really making people aware. And because you're giving them pre-lambing, it can be difficult to fit them in alongside other boosters. So your Clostridial diseases and Pasteurella, and maybe you'll be giving a footrot vaccine. Next slide. So antibiotics for watery mouth, they have been very widely used, as we all know. But these days, it's considered, I took this from the Sheep Vet Society from a bulletin they put out recently, that's inappropriate to use prophylactic or basically preventive antibiotics to control watery mouth. So the days of giving every lamb a squirt or a tablet really are gone. Perhaps there may be a justification if you have a problem to use them in high-risk groups like just your triplets or something, but to dose everything is really not considered good practice anymore. I mean, in some countries it's banned. It's not totally banned here, but it's strongly discouraged. And there's now only one UK licensed oral antibiotic for lambs, and there are problems with its availability this year. So there aren't really options for this. And although in the past, some vets have prescribed things like oxytetracycline tablets for lambs, all the small animal tablets, ones that are licensed for dogs and cats, don't have a product license for livestock. So there is no MRL or withdrawal period, and they shouldn't be used. Vets should not be prescribing them. And next, please. And this graph shows you really what has happened from using so many antibiotics over the years. So this is showing from the isolates that have been sent in to APHA, you know, the labs at Shrewsbury or Aberystwyth or wherever, where people have sent in samples from lambs, say with watery mouth or scouring baby lambs, and then they've tested them against different antibiotics. So the common ones that have been used would be spectinomycin, Inspectam, and look, 40-odd%. That the purple is for 2018, blue is for 2019, red is for 2020. So it does seem to have actually got a little bit better, but that's probably, I doubt that's significant. So around 40% of isolates from baby lambs are actually resistant to spectinomycin. And then if we look at tetracyclines, which are very widely used in terramycin, alleamycin, all those drugs, over 60% resistant. E. coli are resistant to those. High level resistant to ampicillin, which is a penicillin, and high level to streptomycin, say in Penstrep. So this is what happens when you keep using the same antibiotics, or you keep using any medicine really, the bacteria develop resistance to them. Next slide, please. Just going to mention probiotics. Probiotics are really sort of healthy bacteria. So when you're giving probiotics, the idea is to colonize the gut with healthy bacteria to prevent the E. coli invading the gut. But there is no reliable data on whether they are really effective or not in lambs. Next slide, please. The lambing environment is obviously important. So stocking density, and I've just got a list of things here really. Cleanliness of the yards and pens, cleanliness generally, the staff handling the sheep, how frequently you bed it. Interestingly, in the neonatal survival study, when they looked at frequency of bedding for cows at calving, not surprisingly really, when the yards were only bedded when they looked dirty, there was a much higher mortality rate than when pens were bedded on a regular basis every day or every other day. Stomach tube is one really to watch because you can spread disease between lambs if you tube a lamb that's already infected with E. coli and then tube another lamb. You can spread the E. coli from one lamb to another. You can spread jointial that way too. So it's really important to wash it between litters. Wearing gloves for assisted lambings. The bacteria that causes jointial can be found in the ewe's vagina. So if you're not wearing a glove, you can spread that between ewes. It's important to have warm water in the lambing shed, and I also think it's important that it's well lit. I sometimes, go into lambing sheds where it's pretty dark and you can't notice the lamb that hasn't sucked or anything just because there's not enough light. New slide, please. Basic stuff here. Treating navels, ideally treat them twice, once within an hour or so of birth and then again when they're dry. And the whole of the navel needs to be thoroughly covered, and it's often easier to do this with a dip cup with strong iodine in rather than a spray. Next slide, please. Moving on to jointill. Basically, jointill is an infection that gets into the bloodstream and then settles out in the joints. In baby lambs, the causal bacteria is almost always Streptococcus discalactii. Another bacteria, erysipelas, can cause jointill in older lambs, but it very rarely causes disease in baby lambs. An infection can gain entry through the mouth. It can get in even as the lamb's being born, through the navel, with ear tags, so that can be a risk with tagging lambs at birth, or with rubber rings used to castrate or tail dock. Next, please. Typical lamb with jointill, multiple joints affected. And in the next picture here is a lamb with spinal jointill. And the next, this is from that post-mortem of that same lamb. Obviously, this is an older lamb, so that infection wouldn't have got in there at birth. You can see here, that's the post-mortem. This is the ribs after the post-mortem, and there is the abscess against the spine, deviating the spine and causing paralysis of the hind limbs. Next slide, please.
Harriet, could I just interrupt you on that, on the jointill there? I've just had a question came up that's sort of speedily pertinent. There's how quickly can it occur, the joint ill?
How quickly can it occur? Very quickly. So if it's happening, say, from tagging, someone's tagging lambs at less than 24 hours old, the very next day there can be some signs of the joint ill. They wouldn't necessarily have a swollen limb by the next day, but in fact, what's quite common with tagging is they get joint ill in the bones of the neck, and so the lambs will go off all four legs very quickly, but it can happen within 24 hours of the infection getting in. And I wanted to mention here castration and tailing with rubber rings. And I think it is worth us continually addressing the question, do we really need to do it? Or do you need to do it in every situation? Castration and tail docking are banned in several EU countries, and in some countries rubber rings are specifically legislated against. So I think we all know it's something that continually sort of crops up in this country with reference to welfare, and I'm sure it's going to keep cropping up more and more. Using rubber rings, lambs should be more than 24 hours old, but no more than 7 days old. Now, being more than 24 hours old, there is no legislation to say that, whereas there is to say they shouldn't be over 7 days old. But you don't want to be doing anything with a lamb that's less than 24 hours old that might affect it getting up and sucking and feeding. So even if you want to turn your lambs out earlier, maybe you shouldn't be ringing them, but you don't really want to be ringing them less than 24 hours. Next point, please. But wounds from rings, you know how the ring gradually cuts in, are often the entry point for bacteria causing joint ill in older lambs. And I'd suggest, you know, that photo I showed of that older lamb with the spinal joint ill, that could very easily have come from the tail ring. Next slide, please. Treating joint ill, you need to treat early. And this slide shows, this is resistance data shown in a slightly different way. So these figures here, so let's look at tetracycline that I've got highlighted here. 17 out of 22 in 2018. That means of the 22 isolates of Streptococcus dysgalactiae that were tested for their antibiotic sensitivity, 17 of those were resistant to tetracyclines. Then it was 23 out of 31. So tetracyclines do not work against joint ill generally. Whereas most of these others, actually the resistance rate is very low. For amoxicillin clavulanate, that's Sinulox or Nuroclav, 0 out of 22, 0 there, 0 there. So generally, Streptococcus dysgalactiae doesn't have a big problem with resistance. So when you're treating and they're not getting better, it isn't because the bug is resistant to the antibiotics. It's more because the changes in the joint are so severe that nothing's going to sort them out. So really early treatment, it's only worth treating joint ill if you treat them early. If you've got a lamb like that picture I showed you with multiple joints affected and they're severely thickened, euthanasia is the kindest and best option. Next slide, please. Just want to say a little bit about lame ewes, because we highlighted earlier that lame ewes often have subclinical twin lamb disease and are more at risk of having lower birth weight lambs, producing poorer quality colostrum and less colostrum. Next slide, please. Oh, and also reduced mothering behaviour. This is a diagram of the 5-point plan for lameness, and all parts of the plan are important, but when you're coming up to approaching lambing, or where you use a pregnant, only certain of these really are options to you, aren't they? You're not going to be culling ewes that are late pregnant. So you can, next points really, Tom, please. So you can obviously treat them and you can vaccinate ewes pre-lambing. Next slide, please. So a few points now on the use of footrot vaccine pre-lambing. Footrot vaccine, in a way, is a bit like the COVID vaccine in that single booster doses do give a degree of protection. So ideally, you want to initially start with 2 doses, but you don't have to. So you can just a single dose will reduce the level of foot rot in a flock. And you want to be giving booster doses, a bit like COVID vaccine that we've been, all boosted because of the risk of the Omicron variant. You want to be giving booster doses of foot vax before a period of high transmission risk. And housing is a high risk. You've got the warmth of the bedding and the moisture and a high stocking density. You want to avoid vaccinating for foot rot within 4 weeks of lambing, and allow 2 weeks between vaccinating for foot rot and other vaccines. So it can be, you've got to think about when to fit it in with your pre-lambing clostridial booster. I think with pregnancies, it's important, well, it's always important to give the vaccine under the skin, not into the muscle. So you have to pull the skin up and carefully inject it into the space rather than just sort of intra-sheep. But it's particularly important in pregnant ewes because if you inject it in the muscle, ewes can be quite unwell. They've obviously got a sore neck, and you don't want to be putting ewes off their feed in late pregnancy. And last point, I just wanted to mention as well, this last point is that avoid giving it to sheep that have had Cydectin 1% injection, or the other way around, giving Cydectin 1% to sheep that have had foot vax. And that's purely because they both have the same adjuvant, which is the thing that sort of carries the injection. And there have been cases of fatalities when the 2 products have been used in the same animals. Not always, but there's always the risk. Next slide, please. So just going to summarize now really all the points that we've been through and things that you can be thinking of doing now in the run-up to lambing. Group ewes according to body condition score and keep yearlings separate from mature ewes. Know what you're feeding, so you want a forage analysis and a good analysis of the cake you're feeding, which often means you've actually got to request that specifically from the cake manufacturers, and then try to get someone, a nutritionist or someone, to help you just to formulate the ration so you know that you're meeting the ewe's protein and energy needs, and that she can eat as much as you think she needs to eat. And the other thing is how you're offering the feed. Can all the ewes get their share? And that's really, really important. It often isn't just what's fed, it's how it's fed. Speak to your vet, maybe about checking the nutritional status of the ewes pre-lambing with a metabolic profile, and or possibly looking at antibody levels in lambs to see that it can be reused. I think that can be a useful thing to do so that you can see if what you've been doing has achieved good levels of antibodies and colostrum. Next, please. Consider testing for doing some worm egg counts and testing for fluke in pregnant ewes. Next, please. Focus on hygiene of everything, really. Yards, pen, staff, overalls, gloves, stomach tubes are very important. Ensure all lambs have this minimum amount of colostrum and try to encourage them to suckle rather than just resort to the tube every time. Think about whether castration and tailing is really necessary, and perhaps how you're going to do it. If you had a joint or problem, you might think maybe this is the year not to be using rubber rings. Do everything you can to control lameness in the flock. And much more long term, but in self-replacing flocks, so if you're breeding your own replacements, keep selecting for traits like good mothering behaviour, for ewes that can hold their condition even though they've reared 2 good lambs, ease of lambing, all those valuable traits. And next slide, please. That's yes, the the end of the presentation. So thank you all for listening. And I found this picture on the internet recently. I haven't really studied it to see if it's computer generated, which obviously it may be, but I thought it was an amazing example of ewes being fed so they could all feed at the same time, which actually is always the aim, really, and then there's no competition.
Harriet, that was absolutely fantastic. Really, really, really good talk. Thank you. Generated a few questions. I'll sort of take the most recent, give you the most recent first. Is cow's colostrum any good as a substitute in lambs rather than buying a powdered colostrum?
Yes, that's a very good question. And yes, it is. There is a risk with cow's colostrum in that some cows produce antibodies that can react with the lamb's red blood cells and cause a fatal anemia, i.e. the lamb can die from having cow's colostrum. So it's generally considered the best policy is to use pooled colostrum rather than to use it from one single cow, because it isn't all cows. So the chances are, if you pool the colostrum, you won't have a problem with that. But it's also important as well, I think, to make sure, check the cow's colostrum, that has a good level of antibodies. What you don't want to happen is that the cowman keeps all the best colostrum for his heifer calves and gives the shepherd the poor quality colostrum that they don't want to feed to their heifers, which I think is what sometimes happens. But generally, I would say yes, the best colostrum is the lamb's own mother. The next best is colostrum from another ewe, and then it would be from dairy cows on the same farm. But one other thing perhaps to be aware of with using cow colostrum is that Johne's disease is pretty common in dairy herds in the UK. It's not uncommon in sheep flocks either, but it's more common in dairy herds. So there is a potential, if you're keeping your own replacements, that you could introduce Johne's from feeding cow colostrum. So it is better than powder colostrum, but with provisos, really.
Yeah. And then just sort of going backwards from that, then can you use anti-inflammatories in very young lambs if you have got an issue with?
Yes, you can. Yes. So if you're using, well, I just use it at the standard rate. According to, if you've got a lamb that's only 4 kilos, you could probably dose, could safely dose it for 5 kilos. So round it up a little bit. Yes, you can safely use anti-inflammatories in baby lambs.
Yeah. Just one point I've made for myself actually is you mentioned dipping navels with strong iodine. Just a watch point really is that strong iodine is a term rather than a strength. And you can actually, if anything over 7% is considered strong, but 10% is as strong as you can get. So I sort of always recommend to go for 10%.
Yes, no, I'd agree with you there, Andrew.
Yeah.
Thank you.
Yeah. Going back to the blood sampling, what's the sort of cost if you had a 500 ewe flock? What would the cost of that blood sampling be 3 or 4 weeks before lambing?
Well, that's slightly difficult for me to answer because it does depend. Most labs do a sort of offer a profile which is a reduced cost compared with choosing all the individual tests. And so if you had a 500 ewe flock, you might want to sample maybe, well, it just depends how they're grouped actually. So you may want to sample your yearling twins, your mature twins, and your triplets.
Yeah.
And if you send it to, there's different labs that do it, it's quite variable. So you might be spending, may I be very evasive on that question, Andrew?
Yeah, of course you can.
I think people should speak to their vet because...
Yeah. Well, I tell you what then, I'll just twist it around a little bit. you obviously like to do blood tests on your clients' farms. How often do you think you actually get the client to alter their feeding regime on the back of that blood test?
Okay, well, I would say I do like to do it on farms where my feeling is that things aren't quite as good as they should be.
Yeah.
Whereas on other farms, when the forage has been analysed, maybe they're on a TMR or whatever, we're pretty happy. And we know from years of experience really on those farms, I suppose, that we don't really need to check the ewes. So it's only really where I'm concerned, and my most common concern, to be honest, is feed space and access is much more so than what's being fed. That means that some ewes aren't getting what they need. So what did you actually really ask me there, Andrew? Because I can't.
Well, I just wondered how often it affected what the farmer was doing. If you, unless you're doing it because you've got reason to do your blood test, how often you do a routine blood test and actually change the feeding regime because of the result of the blood tests.
I think people do change, but it's more often probably that things change for the following year. They realise that actually things haven't worked great that year, and next year they're going to set things up slightly differently to try and get things better. And then we blood test again and try and show that we have improved things by making the changes.
Yeah, lovely. I've just had another one popped up here. It's about the sort of general hygiene. What do you advise cleaning the stomach tubes with to ensure they're thoroughly clean?
If it's just cleaning them in between lambs, rinsing them, but actually, and then maybe keeping a bowl or something of something like Milton or something used for sterilising baby bottles. So it's very, it's safe for baby lambs. You can dip it in that, run it under some water, and then use it again. So the type of thing you would use for sterilising baby bottles is what I would go for as a keeping your stomach tubes in. Yeah.
I was interested to hear what you were saying about the E.Coli vaccine, because of those of us who've been around as long as I have will remember we used to have a vaccine called Coli Vac, which actually was really difficult to sell. We thought it was going to be, when it was launched, we thought, this is what, 35 years ago, Rod, I expect, isn't it? It was a super product, we thought, and we just couldn't get it off the ground, and it failed, the product, unfortunately. But there you go, it's another thing.
Well, I think you probably got the impression, I think if you get your management right, you shouldn't need vaccines. So I just it is it's something that is being used a little bit. So I just wanted to mention it.
Yeah, no, that's fine. It's lovely. It's lovely for people to know about it. That's good. Harriet, that has been a great talk. Thank you. I mean, there's so many. I've written down little bits and pieces of little take-home points.
Excuse me. There are a couple more questions you haven't answered yet.
Oh yeah.
On the chat.
I couldn't see those, Rod. Where are those?
The first is how do you suggest is the best method to treat entropion?
Oh, I didn't see that. When did that pop in?
Well, I suppose if you see the lamb really early, it's just to pull the eyelid out, and some will just stay. And then either, as you can tell, I'm slightly reluctant to say which is the best method. Different people use different methods successfully, and some people are happy to inject into the eyelid. Other people will use Michel clips with little like staples to pull the eyelid down. So I think it depends what people are happy with. If the vet's shown you how to inject into the eyelids and you're happy with it, but I think everyone would agree it's not the easiest thing to do and not the most pleasant thing to do. So I think I'd encourage people to have a chat to their own vet about that one, really. And another thing would be to try and select against rams that tend to throw it, because there is definitely a genetic predisposition to it.
All right. Are there any more questions? I haven't missed any more, have I, Rod?
There's one. There's one beforehand actually, Andrew, about
Well,
colostrum in your hands.
Well, Harriet's already answered that, really.
Oh, right.
But, yeah. Let's go. Starting again with summing up. A great talk, and I think what it tells us to start with is just about it's that begins with the health of the ewe and the body condition score, etc., etc. There's lots of things for us to think about and everybody get the teeth into. So Harriet, just marvellous. Thank you very, very much. Has any further questions? If not, I'll say good night to everybody. Thank you.
Thanks, Harriet.
Thank you. Good night, everyone.
Okay.
Thanks.
Good night.
Bye.
Bye.